Alrighty, can you all hear me and see the screen? Alrighty, so thank you all for squeezing me in here. What I'd like to do today is offer some of my thoughts on where I think we are in terms of the numbers and where we are, I think, at least with regard to the Monroe County portion of the Finger Lakes region's performance in the reopening metrics. So I'll just plow ahead here. So first I want to talk about the testing. As you know, we have seen an increase in the amount of positive tests. And I want to first point out that the daily reports that we send out in terms of the positive tests doesn't necessarily correspond to that day, nor does it correspond consistently to the day before, because many of the tests that we get come from different labs, and the labs each have different processing times. And so a test that was received today may have been sent from a lab a week ago, and we may just be getting the positive result today or yesterday. So whenever I do these graphs of testing, I always show you the numbers as of the date of the test itself, meaning the date on which the individual had their specimen collected. So this is a reflection of the testing that is done by day across the county. And as you can see here, the number of tests that we've performed as a county has increased dramatically since the beginning of May. And we had been in a position where the percent of positive, the percent of tests that come back positive had been declining. But you'll notice there in the last probably 9 days, we are seeing that coming back up again. And I believe that's because we are doing a more focused job in terms of testing people who we think are more likely to be positive. So let me give you some examples of that. So again, in addition to testing more people in general, testing more people who are symptomatic is much more likely to yield a positive result than testing somebody who is asymptomatic, although we know that those can be positive as well. We are testing symptomatic people who we've already identified through contact tracing. So these people are almost a guarantee of being positive, because once we identify a case and we do our contact investigation, identify all the people that person has come into contact with, we identify people who we presume is positive. In the past, we had not been testing those people because the testing capacity did not allow it. But now that we have more testing capacity, we are testing the household contacts of known confirmed positives. And so as you can imagine, because that's the highest risk situation, is sharing a household with somebody who's positive, particularly before they even know that they're positive, it's no surprise that those people come back testing positive. So that's why we're seeing an increase in the percentage of tests that are being done and they're showing up positive. We're also testing more in the nursing homes, and we're testing more in the hospital. So the testing in the nursing homes, as you can imagine, is because we're trying to identify people who are at risk, and these are people who are in the nursing home currently. We're trying to test them to identify people who are positive so that we can take appropriate precautions, utilize PPE as appropriate, and just have that general awareness in the nursing home. And then we're trying to do the same thing in the hospital. Same idea, trying to identify people who are positive because we want to be able to treat them accordingly. So what you're seeing now is, let's get that. This is the number of positive cases by date tested in Monroe County alone. And so you can see there that there is an increase in the number of positive tests that we're seeing as a county. I would not trust the numbers from yesterday or the day before yet, because like I said, we haven't gotten many of those results back yet. So in 2 or 3 days, we'll see the results from yesterday and the day before. So I wouldn't make too much out of the last couple of days. So, but by and large, we're definitely seeing more positive tests. So this gets to the hospitalization numbers. So in the gray dots, that's the number of people hospitalized, admitted to the hospitals on the given day. And then the blue is the number of people who are on mechanical ventilation in an ICU. So as you can imagine, the red line is the sort of best fit line that I've tried to put onto the admitted number, and the blue line is the best fit line for the ventilated number. The red line obviously is going up, and we'll show more information on that. But I think the good message is that the number of people who are critically ill in the ICU on a ventilator has remained relatively stable. So to get at why we're seeing more people hospitalized. Now, before I say that, I want to put a caveat on that, which is that first of all, what we're reporting every day is the number of people who have a COVID positive test who are in the hospital. It doesn't mean that they entered the hospital that day or the day before, because as I mentioned before, we're now testing people in the hospital essentially as universally as we possibly can for COVID. A good number of these people have been in the hospital for days or weeks, and they may have acquired the COVID in the hospital, but much more likely they brought it into the hospital and perhaps we didn't know it. So that is why we're testing more. So as a rule, when we look at the population of people that are being admitted, when we look at where they're coming from, I'm showing here on the left by housing status. In blue is people who come from a private residence. Orange is people who come from a nursing home or assisted living facility. And then the other group settings is independent living, group homes, high density housing, homeless individuals, and probably a couple others. So what I'm showing to you here is that on the admission side of things, these are all of the people admitted by the date of their admission. Okay, and I'm just showing here the last 15 days or so. But as of the date of their admission, a good proportion of these individuals are coming from nursing homes and assisted living facilities. So these are people coming into the hospital, or people who are already in the hospital being tested for COVID, people that came from nursing homes and assisted living facilities. On the right side is by date of discharge, the types of living arrangements that these people have when they go home. And these are people who have been discharged, have left the hospital. As you can see, the vast majority of them are blue bars, meaning that they are all going back to private residences. So when you take the left minus the right, essentially this is what you get. And this is currently admitted individuals by type of housing. And just to make it interesting, I showed to you the difference in acuity. Inpatient in the ICU not on the ventilator, and inpatient in the ICU on the ventilator. And as you can see, the vast majority of people are in the hospital just on the regular floor. And of those on the floor, the vast majority of them are people who had lived in a nursing home or assisted living facility. So let's get into some of the regional metrics. Now, I'm not able to show you the regional data because I don't have access to all of the different counties in the region, but to the extent that the main hospitals in the region are Monroe County, I feel like these are good proxies for how we're doing as a region. So metric number one talks about net hospitalizations. So that's admissions minus discharges. And what I'm showing to you here in blue is literally on any given day, the number of people who go into the hospital minus the number of people who go home. And that's sort of your net impact on hospital capacity. And as you can see there toward the right, again, I wouldn't make too much out of yesterday and the day before, but you can see that we're consistently more positive than we had been prior to May 10th or so. So in general, we're adding on average maybe 5 more people net per day into the hospital. So that's what's going to impact the available capacity for a surge if and when we need it in our hospitals. So that's essentially metric number one. And as I think many of you know, the governor reset the metric on that. We had been at an 11, now we're at a 7 last I checked. So that's where we are on that metric. So this is not a metric, but this is important to show, obviously. These are all deaths in Monroe County by date of death. So as you can see here, it ranges from 0 to I think 7 was the highest on a given day. And this is by the date of death. Again, there's a contrast here between what we're reporting, because when we report on a number of deaths on a given day, not all of those deaths happened on the same day. And so when we go back and plot those by the date of death, this is what you end up seeing. And I showed a 3-day moving average here just to give you perspective, because on the regional metric number 2, this pertains to hospital deaths by date of death. So the previous slide was all deaths, and obviously not all deaths happen in the hospital. So as I read this metric, I'm talking about deaths in the hospital. And so we need to stay below 5, and we currently are. So from this metric's perspective, we're doing all right. So this is the new hospitalizations. Okay, so these are people coming into the hospital. So we're not looking at discharges here. This is new hospitalizations. These are, again, people who are coming into the hospital and people who are already in the hospital testing positive. And this is metric number 3, where we need to experience fewer than 2 new hospitalizations per 100,000 residents. Again, this is only Monroe County. I don't have the stats for the entire region, but again, most of the hospitalizations that happen in our county happen here in our hospitals. So what I'm showing to you is a somewhat incomplete picture, but I think it's still instructive. By my math, given our population, we need to stay below 14.8 new hospitalizations per day. And this is just for Monroe County again, as a 3-day average. And we are currently, as a 3-day average, under 14.8, but obviously the last few days have been higher. And so this is a number that we need to follow very closely. But this is the metric that I think we're the closest to not passing at this current time. So with that, I'm going to turn the microphone over to the group, and I'll take your questions. And I think Steve is going to help moderate here for us.
Okay, our first question will be from Tanner Jubenville from Channel 13, followed by Jeremy Moll of City News.
Hi, good afternoon, Dr. Mendoza.
Good morning, or afternoon.
So I was reading your Twitter threads over the weekend. It seemed as though it may not be, you indicated that the state mandate regarding hospitals and nursing home residents may not be the only reason for this increase. What other reasons might there be? And
I mean, it's possible that people are actually sick. You know, I think we have to keep that as a possibility here. There's no reason to think that they're more sick now than they were, you know, before the 10th. But I think that has to still be on the table, you know, and I haven't dug into the individual cases and to understand, you know, is there something else? You know, I think the temptation we have is, you know, when we identify sort of the obvious, and I think other counties in the state have also identified this, what they think is obvious. I think it is reasonable to conclude that May 10th sort of seemed to be the beginning of all of this. But I do think we've got to be thorough in looking at the data. And I think we need to dig into these individual cases to see, are these people truly sick, and do they truly need to be in the hospital? And if that's the case, then they're in the right place. So I think but my leading explanation right now is, you know, if you look at May 10th, it seems like a pretty stark upturn. So but I am open to other possibilities, and I'm trying to look into those.
Okay, Jeremy Moll of City News, followed by Wendy Wright from Spectrum.
Hi, Dr. Mendoza. Over the past month, I've been kind of tracking the positive test reports that the county puts out, and I've been doing it by age group. And it appears rather consistently that more people in their 20s have been testing positive than really any of the other age group. You know, I tried reaching out to the health department a few times on this, hadn't received a response. I realize you guys are probably incredibly busy, but I'm wondering if you're aware of this trend and if you have any sort of explanation or insight into it.
Right. So this is a trend that we've seen since the beginning. And I think, you know, I would say that it's probably more pronounced now as we are testing more. So some of these new positive individuals are under the age of 10. And so these are younger individuals. Many of them are contacts of people who are confirmed positive. So these are family members. These are kids of current confirmed positive. So there's that. I think there's also still a fair number of testing of essential workers, and to the extent that younger, typically female nurses, CNAs, techs who work in healthcare settings, you know, I think there's an overrepresentation of younger females in healthcare, and I think that is an explanation that we're seeing here. I'd say those are the two main explanations that I would offer now, but I think for right now, yeah, I think probably the bigger one, honestly, is that we're testing more presumed positives in a household. And so I think that's a big explanation for why we're seeing more in the younger groups.
Okay, next we have Wendy Wright from Spectrum, followed by Brian Sharp from the Democrat and Chronicle.
Hi there, thank you. Wanted to ask you how our region's numbers are looking in terms of being considered to be prepared to move to phase 2 on May 29th, and how possibly the nursing home cases and those numbers are playing a role in that decision.
Well, that decision, as you know, is at the level of the state. So I really can't comment on what they're going to do. You know, my perspective is, you know, trying to offer, you know, my best representation of how we're doing as a community in terms of the risk. Now, the nursing home individuals in the hospital, I need to figure out to what extent they're impacting the available capacity in the hospital. Because as I said, if these people were already in the hospital and they're just now testing COVID, they actually have no impact on hospital capacity because they're already in a bed anyway. So I'm trying to figure out if these are new individuals in the hospital or if these are new identified cases in the hospital. So that's the first thing I need to figure out. But certainly if we're eating into the available capacity into the hospital, that's concerning to me, because we want to be able to take care of a surge of people if that ever happens in the hospital. So I think from the hospitalization standpoint, that's what I care most about, that we have more people in the hospital who are nursing home patients who we're taking good care of. I think that's great. But at the end of the day, I don't want that to eat into the capacity available in the hospital. So we just got to make sure that the numbers are actually a reflection of reality.
Thank you, Wendy. Next up, we have Brian Sharp from the Democrat and Chronicle, followed by Berkeley Green from WHEC.
Thank you. Dr. Mendoza, I was hoping you could address testing with the state mandate for twice a week testing of nursing home, adult care center staff, how that is going to be accommodated and what kind of impact that'll have on testing capacity.
The state yesterday, or what day is today? Sunday, they released a whole lot of test kits to the nursing homes across the state. And so as I understand it, the nursing homes have the capacity to do twice weekly testing for all of their staff. And they're getting shipments from the state on a weekly basis to ensure that we have a sustainable plan to do that testing. And so certainly I anticipate that we're going to get more positives. And that's going to have a number of consequences. One is for all of the positives, those are people who are no longer eligible to be in the workforce for that nursing home. So that's going to create a workforce concern for the nursing homes themselves. So that is something that we've been looking ahead to, working on the staffing pool that we announced last Friday. That is a real concern. And then the other concern, obviously, is the impact on contact tracing here in the health department. The more we identify, the more we need to investigate. And that's how we should do it. But those are the two most immediate impacts that I can identify for you today.
Okay, next up is Berkeley Green from WHEC, followed by Rebecca Fath of WROC.
Okay, thanks, Steve. And just if we can figure out if we can ask a follow-up, I don't know, we asked 2 questions now or follow-up later on, but just want to make sure I get
for today, it was just one question. If you have a follow-up, you can send it to me and I'll be sure to get you an answer.
Dr. Mendoza, do you believe we're on the right track or the wrong track?
What track are you referring to?
The numbers that you showed us. Are we going in the right direction or are we going in the wrong direction in terms of reopening and staying open?
I think we're on the right track. I think we need to be vigilant. You know, we see signs that are reassuring every day, and we see signs that are concerning every day. And I think it's oversimplifying to say, right or wrong. I think we've got to be thoughtful about how we look at these numbers. When we look at the hospitalization numbers, yes, they look like they're going up, but we've got to dig into that. And at the end of the day, are people sicker now? I don't believe so. Is this eating into capacity potentially? Yes, we've got to look into that. But as a community, I think the bigger metric of how we're doing is what we're not measuring. It's how people are responding to our recommendations to maintain that physical distancing, to build those habits around hand hygiene and disinfection and wearing the mask. We don't have a good metric for that. But quite honestly, that is the metric that I care the most about, because I think that is what will give us the best prediction of how we're going to do in the weeks and months to come.
Okay, next up is Rebecca Fath from WROC, followed by Patty Singer of the Minority Reporter.
Hi, Dr. Mendoza, how are you?
Good, thank you. Good afternoon.
So, good afternoon. So my question is, if you can answer this, how many people in the county do you believe are infected so far that have not been diagnosed? And is that something you can even judge based on the numbers you just presented to us?
Nobody knows that answer. What we can estimate based on our screening of asymptomatic people is that in this county or in this community, we would estimate somewhere between 2 and 3% of our population has been infected. Certainly lower, we know that New York City, for example, is 20%. We're nowhere near 20%, I guarantee that. Based on our screening of asymptomatic people who are unsuspecting, otherwise healthy, feeling fine people, we're getting, somewhere between 1% and 2% of them as testing positive. So, it's really a best guess, but somewhere between 2% and 3%.
Okay, thank you so much.
Okay, Patty Singer, the Minority Reporter, followed by Brett Dahlberg from WXXI.
All right, thank you. Dr. Mendoza, you touched on this a little bit. The measure is people who are doing the physical distancing, wearing the mask, hand hygiene. Coming into Memorial Day weekend, we've already seen gatherings, things like that. I've been asking my questions all have really been around mental health and behavioral health. It sounds as though now we're really moving into a behavioral health approach to getting people to buy into this for the long term. Where are the behavioral health, mental health, the people like Kim Butler taking an active partnership role in this, moving from the medical model into a behavioral health model for the long term?
You probably got about 5 questions in that one question, Patty. But so first, what I would say is that behavior and behavioral health are somewhat different. What we're trying to motivate people around is a new behavior. And there's a lot of impatience, there's a lot of fatigue, there's a lot of questioning, and I think that's understandable. What we're trying to motivate is a difference in behavior, a change in behavior. And behavior change, we know from a lot of studies, takes time, on average 21 days before somebody takes a change in the behavior and it becomes a habit. So, I'm not sure that we're even 21 days into, some of these interventions. So we've got to keep at it. That Memorial Day is coming around the corner is giving me concern. We know that from our contact tracing, we've identified a number of positives who've disclosed to us that they had an event on Mother's Day, or they had an event, a gathering of some kind the weekend, I think, prior to that, which was a nice weather weekend for us here in Rochester. So, we're hearing about this from an anecdotal perspective, and I have to assume that we're not always getting the full picture when we talk to people who are positives, because there's an inherent bias toward non-disclosure when it's something where potentially there's a potential for being, judged. So, so that's the behavior part of it. As far as the behavioral health part of it, there's no question that isolation, which is why I'd like to try to move us toward physical distancing as opposed to social distancing. But there's no question that there's an isolation happening here, both psychologically and physically. And I think that physical isolation has led to social isolation, which has led to an increase in the number of overdoses, an increase in mental health concerns. One thing I would offer, though, is that we're seeing the no-show rate in mental health practices go down. No-shows are when people have an appointment but don't come to the office for whatever reason. But we have noticed through changes in our healthcare system, we're implementing telehealth, medicine, telehome visits. People with mental health concerns are accessing those services more than they were before. There's certainly a lot more that we need to unpack in that observation, but I do think that's a step in the right direction. But make no mistake, mental health is the other side of the coin when we think of physical health, and so we're definitely paying attention to that.
Thanks.
Okay, Brett Dahlberg from WXXI is last, unless there's anybody on the line who is not.
Thanks, Dr. I'm going to try to pull a Patty Singer and ask 2 questions. But I wonder how much harder it is to do contact tracing as things start to reopen, and whether there's any chance that the reports that we get usually at 4 p.m. That have been coming out a little bit later than that might be coming out later because of efforts at contact tracing, or just what's behind, what's slowing you all down?
That's it. With every contact we get, with every positive case that we get, we're estimating around 2 to 3 contacts come from that positive case. So if you do the math, we've got sort of 50 new cases in a day. On average, it's 150 people we've got to contact that day. And so I've told my team repeatedly, I don't want to hear about needing to expand our Army when we need to expand the Army. I want to have expanded the Army so that we have the Army available for when we have more cases. So that's where we are right now. We are reconfiguring the health department staff. Those staff that were working long hours early in March when we had more cases, we're bringing them back to the COVID unit to do the contact tracing. As many of you know, the state has put together the Bloomberg model of developing the staffing for contact tracing. All of our staff on site have gone through that training. I've done the training. We've taken the test. It wasn't anything particularly new to all of us who do contact tracing, but we are developing that army of people who will be coming in to help us with the contact tracing. We have volunteers who we've had on deck for months now. We're having them get trained. Many of them are nurses and retired physicians who don't actually need that much training. So this is a refresher course for them. And then we're working with the state. The hurdle with the state army of contract tracers is that we have to go live with the ComCare IT system, the management platform, the computer system that all counties have to go live with. And so we've got to go live with that before we can utilize the Bloomberg contact tracers, if you will. So that is what we're in the middle of, but we're going to be going live with that new platform on May 27th, which is I think next Wednesday. And so, we've got a plan to get through to then, obviously following new cases, but I'm planning on more cases. I have to. I mean, that's the right thing to do. And if we end up not seeing those cases, well, then that's great. But we need to plan for more cases.
Thanks.
Anybody who did not get a question? If not, then you can send your follow-ups to me. You can email it to me, and we'll be sure to get you an answer. Thank you, everybody.
All right. Thank you all. Have a good day.
Thank you.
Thanks, y'all.
Thank